Okay, 30, all rise to the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone. The agenda as printed unless there's some additions.
Second.
First and second, all in favor?
Aye.
Any opposed? Motion carries. Approve the minutes from February 10th.
I'll make that motion.
I'll second it.
We have a first and a second. All in favor?
Aye.
Any opposed? Motion carries. Approve the claims.
Okay, I looked through them and drainage was $7,145.66. General was $108,889.64. I'll make that motion.
What's up?
I'll second it.
Marty, what was it? Was it a bunch of?
108,889.64.
0.64.
Okay.
It's on the back.
Yeah.
It just, I didn't sign it. Okay, all in favor?
Aye.
Any opposed? Motion carries.
Okay.
Okay, general public concerns. There's the general public that isn't on the agenda.
Hi, Chair. This is Bree Erskine with Humboldt Wind and RWE. I just wanted to share for the general public and for public comment that we will be holding an open house in March. We did find a date. I know when we were there a couple weeks ago, we said we were kind of looking for some time and space. And we did find some space at the Humboldt Library in Humboldt. And it'll be on Thursday, March 13th from 4 p.m. to 7 p.m. And the whole idea of it is that it's strictly just come for 2 minutes, for 20 minutes, however long you want to come for. We're going to have subject matter experts there to answer questions. There'll be no presentation. It's just strictly trying to make it as accessible and easy for folks who do have a question or want some extra information to just pop in and pop out without any kind of interruption to their day. So we're hopeful everybody can make it. I'm hopeful y'all can make it. But we really were hoping that as many people as would want to or have questions or just interested in learning a little bit more. We just wanted to make it as accessible as possible. We'll have some refreshments as well. We know that time of day is kind of tricky, going to church, going to practice, going from home and school. So we just wanted to make it as easy as possible. So hopefully folks are able to come and get questions answered if they have any.
Oh, what was that time again? 2 to 7?
4 p.m. to
4 to
7
7.
p.m. at the
4 to
Humboldt
17.
Library on Thursday, March 13th. And it's going to be in the downstairs. So it has it's ADA accessible. So if anybody has like a rollator or a cane or anything, it's going to be really easy to pop in and out. The children's section is kind of right next door too. So if people have their kids with them, they're super easy to bring their kids as well. Don't have to worry about anything there. So we're trying to think of everything there to be as easy peasy, but it's really low pressure. It's no presentation. It's just strictly 3 hours of if folks have questions, they can get answers, and or if they're just curious, they can read some of the boards and get information for themselves. They don't have to talk to a soul if they don't want to. We just wanted to make it accessible.
Okay. I do know we have an ISAC convention on the 13th.
Oh,
Yeah,
right.
well, 13th
and 14th.
That's right. May not have very good attendance from the supervisors. Okay, anything else? Alrighty, moving on to the agenda. Michelle?
Yeah, thanks for having us back. So I'm gonna let AJ Mason, our CFO, and Kristen Sewell, our Director of Public Health, actually take the hot seat, but come on, AJ. I was just gonna kick it off with a reminder of how public health functions in the county. So we are very unique across the state that the public health actually reports underneath the hospital umbrella. So they function completely differently than the rest of the hospital. Most public health are actually under their board of supervisor through their counties. But
Thank you.
years and years ago, the hospital acquired our public health, which is what's best. It is great for collaboration and coordination of healthcare across our community. And we can support public health in a whole different realm by doing that. But it is important for you guys to understand that we operate public health at a loss. And so the hospital's bearing the brunt of what public health takes in order to operate in a community of our size. So we'll go briefly through our operations and our financials, and then I'll let you know what our ask is as we move into the next fiscal year. Kristen, I'll let you take it.
All right, my name is Kristen Sewell. I'm the Director of Public Health. Some of you may know me. I grew up here in Humboldt, so I'm a long resident. But just starting off, so we are governed or advised by a Board of Health. So you can see our members here, and Sandy just started finishing off the Board of Supervisor term for us. So she attends our meetings. You attended one, right?
Yep, I
Okay. Flipping to the next page. So something that I think is important to know is that public health is kind of governed by these 10 essential services from the CDC, and these are health activities that all communities should undertake. So they're kind of divided into 3 different buckets: assessment, policy development, assurance. So within assessment, we make sure that we assess and monitor population health, investigate, diagnose, and address health hazards. Some of the highlights of that bucket that we do is we provide nursing and nursing aid services to our community members. Some of our most vulnerable community members, we keep eyes on, weekly, every other week, once a month. We also are required by the state to complete a community health assessment. So we did that in 2023. We had almost 200 responses from the community on what our agency should focus on. The biggest one was mental health. So we have a lot of advocacy and education in that, as well as just healthy behaviors such as physical exercise, nutrition. And then another thing that we would do is so we investigate any state reportable diseases. We have a giant notebook of diseases that we would investigate. Some that you may be familiar with would be Salmonella, E. coli. So we're responsible for contacting the individual who presents positive and kind of doing what have you done in the last 7 to 14 days that maybe contributed to this. And then just any, upcoming or, high risk things. In the last year, we've encountered measles. So we've gotten a small work group together to make sure that doesn't affect our community. Bird flu, while we don't have any large flocks here, we're still at risk because we have a lot of migrating geese in the community. And then last summer during the flood, we passed out a lot of information on how to remain safe in floodwaters and decrease disease if you're working in the floodwaters. For policy development, we communicate, inform, and educate. That's a lot of the work we do. We strengthen and support partnerships. We create, champion, and implement policies, plans, and laws, and we utilize legal and regulatory actions. So some of the things we do for that, we have a lot of great partnerships within our community. In the last year, we've created the Humboldt County Coalition, which is a monthly meeting of a lot of different sectors, and we talk about what's going on in the community as far as health-wise and sharing, the good neighbors, the ministerial, as well as the mental health. And then we also have a really great relationship with our kids' school district. So we were able to train every single teacher, aide, and individual who works at the school and Stop the Bleed, which is a life-saving tactic for individuals who might be bleeding. So assurance, so we ensure that there's equitable access. We have programs that allow individuals who are underinsured or uninsured to make sure they get their routine vaccinations to keep those diseases at bay in our community, we offer food assistance programs like our WIC and our HOPE program for family visitation. And then we have a diverse workforce. I think what's important is as the atmosphere changes, we change and we adapt. So when things happen in the community, we might stop what we're doing and put all our attention on that. So and then just some of the numbers from the last 3 years. Some things I wanted to point out, it would be our personal cares. So we have increased just under 300 visits for that. So that would be anything for showers, helping with bathing, skincare. And I think that attributes to our, a lot of people are staying in their homes a lot longer, needing assistance from somebody. Our HOPES program, we're down in numbers. However, we are only being served by one individual instead of two, but we have really honed in on our focus on those families that really need the support. And then immunizations, you can see we've had a drastic decrease since 2022, but reminding you all that we were still in the height of COVID in 2022 and everybody was getting their boosters and their second doses and their third doses. So we were able to accommodate that, in that public health crisis.
What about children vaccine immunizations? Are those going down or are they going?
As far as like the average rate of people receiving vaccines, so we do pretty well in our community, and that's a really great question. So I monitor every quarter what our Humboldt County vaccine rate is. As far as like the children's routine vaccinations, we're actually really good. So I believe the state's goal is 90%, and we're at 84%, which is actually really good compared to some of the other counties. And we see I think we service about 80 children in our VFC program, which would be offering vaccines to those who don't have insurance. A lot of those are individuals in the school, and we have a great relationship to get those children to us. The school actually provide the transportation to us to make sure they get their vaccines.
So measles has been a big thing.
Yes, so there's a lot of outbreaks. The most current one right now is in Texas. I don't know if you're following the news. But so we actually do pretty well with measles. When it was really kind of heightened, when Chicago and Illinois were having their outbreak, we actually got a small work group together and came up with a plan. So if somebody would call the clinic with signs of measles, we would actually direct them to the emergency management ambulance garage and do all the testing out there. So we could make sure that we kept them away from the safe and healthy patients.
Okay, that's really good.
So,
yeah, great.
And then just some other 2024 completed visits. I think what's awesome is that we have a nurse that does dental screenings. So all of our preschoolers get the opportunity to have a dental screening regardless of their insurance status. And then we also audit every single immunization card record for the school and daycares. So that's a lot of work. So 2013 immunization audits. Funding. So you can see our funding, we've been pretty stable. The ones that have the asterisks are kind of inflexible funding, so we can only focus on those particular services. Our Elder Bridge funds, that is a competitive grant, so every year I have to write an RFP for that, so I am not guaranteed funds. I believe last year my ask and what I got was, I got a $10,000 less than what I asked for, so.
And just to clarify, that's a federal Elder Bridge.
Right.
Federal
I heard
grants,
that's
not our local
going away.
Elder Bridge grants. Yeah.
And then our emergency response, so those just kind of cycle through with what's happening right now. The most recent one would have been the avian influenza. So we have money that we can help educate and inform that specific population. So with that, I sent money to the vets, I've sent money to the dairy farm, in Gilmore City, just letting them know how we can be of service. Now let Angie talk about
Take
it.
the,
Yeah, we'll let you take that.
The money man.
good morning. So,
morning.
I'm AJ Mason. I'm the Chief Financial Officer at Humboldt County Memorial Hospital. What you're seeing here is the 3-year comparative financials for just the Public Health Department in and of itself. Just a quick highlight. So from a revenue perspective, the line item, that's the public health revenue, that does encompass some of those grants that Kristen was talking about. It does also include any revenue that the public health department would generate from vaccines. So if there was some revenue that was generated there, it would fall in that line item. The public county public health funding line item, again, that is the dollars that are allocated by the Board of Health, or sorry, by the Board of Supervisors to the Public Health Department at 95,000. The direct expenses, as you walk down through there, as you'll notice, a majority of those expenses are housed in the wage line item. That's not unique for this department. That's pretty common across the whole hospital. Our largest line item, our largest expense as an organization is wages and benefits associated with those wages. General supplies and other direct expenses, pretty immaterial overall, at about 20,000 in total for the 12 months ended 6/30/24. So as we compare the total operating expense with the total revenue, the total operating expense in fiscal year 24 at 487,000 as compared to the total revenue of 261,000 for about a $225,000 loss. That next line item that you see there, that indirect overhead costs. So because the Public Health Department is a department of the hospital, we are required on our Medicare cost report to allocate certain indirect costs over to that department. Really what that means is from our Medicare cost report, we have to remove those costs in cost-based reimbursed areas. So Medicare does not reimburse us for those and push them over to the County Public Health Department, which is a non-cost-based reimbursed department of the hospital. So we do add those in. Not a tremendous amount of costs in fiscal year 24 at the 23,000, but it does remove some costs, like I said, off of some of the cost-based reimbursed areas of the hospital. And that really brings our total loss in fiscal year 24 at the 249,000. I'll pause for any questions. I know I kind of went through that really fast and at high level.
No, we're going through the same thing. Wages are, and the benefits are always usually the most expense. Now, explain this county allocations to public health, and I down this. What is this?
So this comes from our public health system survey we participate in every year from the state aspect. So we fill out a ton of questions about our revenue, our expenses, what our county provides us, what we use for other grants, our services. And this was from our 23 data. So as you can see in this top line for county public health, there are 18 Board of Supervisors that allocate less than $100,000 to their public health counties.
Which would be us.
Correct.
Have you gotten any more information as far as what they're thinking about doing with public health?
I have not. I do know right now I just submitted my fiscal year 23 grant. And you told us just to keep plugging along as we're doing. I'll likely not see any changes for the next 3 years.
Okay.
The indication we're being given at this point is following the mental health behavioral health districts that are going on. So obviously that does impact Humboldt County as well.
Mhm.
So we're keeping close eyes on what
Good.
that regionalization will look like and then what that could potentially look like from a public health perspective.
Yeah.
It does appear we will be less localized
Yes.
than what we even are today. So there is concern, and with the behavioral health districts, we, between Kristen, myself, and Sean, our director of our mental health department, we have all applied to sit on those advocacy groups in those regions, hoping our names will be attractive to those groups, but just trying to do what we can to stay at the forefront of what changes will look like for mental health and public health as they come forward.
Yeah, well, the legislators keep going with the way they did mental health, they'll probably, I hate to say it, it'll probably go the same way, but I'd hate to see it go that way.
The patients we care for in public health are very important for us to continue to care for going forward. That's where a lot of our costs end up. If we weren't doing the work we were doing for public health, these folks would end up in our ER day after day after day, not receiving the care or the resources that they need to survive.
I think, we attend a hospital-wide patient meeting monthly and talk about some of our most vulnerable, high-risk patients of entering the ER and back in the inpatient unit. And we almost care for over 50% of them every single time. Or we try to get them on our services, so then we can be in their house watching them and make sure that we're getting them the care that they need in the right moment. But moving forward, for the next fiscal year, our ask, is for an increase in support of $20,000, for programs that directly impact, the health and well-being of the residents in our county. We cannot go outside of our county. We cannot provide services outside of our county. So, if they any questions, clarification?
Do you have the ability to levy for this money?
No,
That's what I was wondering.
it all comes through the supervisors
Yeah.
within this bucket. The hospital has the authority to levy taxes, but again.
Yeah,
comes with
and then in the process right now, you're losing money.
That's right.
And that's the problem we're at, too. We're capped in our levy at the state. So it's be difficult.
Right now is not a fun time for anybody.
Well, thank you for that information.
A lot of information.
And do you know, I'm sorry, better calculate.
Yes.
If you ever have questions or concerns or want to know anything, you can reach out to me. That's kind of our job, is to dig into things and find the answers.
Okay, you guys do a good job. Thank you.
Thank you.
We have Shelley with community resources.
Thank you.
Thank you.
And we're going to introduce both of us. This is Ramona Kick, and she's our Partnerships for Success to prevent alcohol misuse for adults coordinator. I'm going to let her go ahead and get started. I'm Shelley Zabel. I'm the grant and contract administrator manager at Community and Family Resources. And I'm supervising right now.
All right, so like Shelley said, I'm the coordinator for the Partnership for Success to Prevent Alcohol Misuse grant here in Humboldt County. So I was just going to give a little overview of the project and why Humboldt was granted that money, and then how our strategies are going this year. So as Kristen mentioned, actually, before, we also work with the Humboldt County Prevention Coalition. And the goal of that is to reduce the number of gallons of alcohol consumed per person of people over age 45 and reduce binge and heavy drinking. Another point is to reduce the number of alcohol-related crashes in the county. So at the coalition, we've been using the funds to raise awareness about alcohol-related negative health outcomes, and we've been implementing strategies throughout the county. So we are continuing to collect data and make new partners with people in the county, different sectors to keep our project going. Some information about Humboldt, why we got this grant would be that 62% of Humboldt County adults reported last 30-day alcohol use, and 3.2 gallons of alcohol were consumed per person between 2018 and 2020, both of which were higher than the state rate for binge drinking. As well as there are 12 licensed alcohol entities per 10,000 people and 35 licensed entities in Humboldt County, which again is higher than the state rate per person.
Should I ask where you get those numbers? Cause I'm,
Yeah,
Nobody ever calls me now.
well, I've never heard of anything.
from
Asking that question.
Iowa.
They
We
sit
call them
outside the
human
liquor
services.
store or?
We were provided the data from Iowa Department of Health and Human Services. And we actually have 3 of these grants, and we could have written for more in the counties that we serve. Johnson County, so Iowa City, of course, we got one there. Humboldt and Webster counties are the,
So
And we have-
we're not only the dirty 30, we're also
The drunk 30.
Wow.
So with binge drinking, we're also addressing heavy drinking. And the 4 strategies we have either address binge or heavy drinking. The strategies are the Wellness Initiative for Senior Education. That's an individual strategy. That's a 6-week course for people over the age of 55 about health and wellness. And then we have 3 environmental strategies. One is the Think Before You Drink media campaign, alcohol restrictions at community events, and responsible beverage server training for restaurants and bars in the county. That's a little example of the Think Before You Drink media campaign. And so where we're at now, I've done 2 completed programs of the Wellness Initiative for Senior Education at the Humboldt Homes and then 1 at the Independent Living Facility. And 2 more programs are scheduled to start in March. Our media campaign has reached over 15,000 people, 45 years and older in the area. Alcohol restrictions at community events sounds kind of scary, but we're not trying to restrict alcohol at every event, just trying to make an environment that's conducive to safe alcohol consumption. So far we've assessed 2 events in the county, and we are meeting with an event board next month to discuss safe alcohol policies. And then responsible beverage server training, we also have 2 of those planned for entities within the next month as well.
And those are hard to do with because servers come and go.
Yeah.
And then plus it's just
Yeah.
getting them, you have to pay them, so some of the facilities don't wanna take that time out.
Mhm.
But it'd be really good to encourage, if you guys know of any, just to encourage them to do it. You wanna say who the 2 are that, and the one's tractor lift?
And then Night Owl.
I know, yeah.
okay. So I'll kind of finish up our presentation with the funding request. The current funding that we're receiving is from Iowa Department of Health and Human Services. This grant is a $90,000 a year grant. And it is a grant that comes from Substance Abuse and Mental Health Services Administration, and then it goes to the state to be determined which counties were to get it. And it was competitive. There were other counties that people didn't write for it, or it is hard to get staff, so.
So we're gonna get a portion of that 90,000, is that right?
The entire 90,000 goes toward salaries, benefits, all of the strategies that Ramona was just talking about. Yeah. And really for the budget, we're required to do like $2,700 per strategy. it's a very, very tight budget to get those things done, because they also had like a required trip. It was out of town, it was a conference for National Prevention Network. So there are a lot of expenses that go along with it. Future funding, we normally request $7,200 to support prevention efforts. We're going to request 10,000 this year to support staff salaries, strategies for the PFS grant. Funding from 24. Wait, I should have made these larger. It was used to support prevention efforts and training, county needs that fall outside of our regular grants that we can't go and do under the Integrated Provider Network grant or the tobacco grant. They focus a lot on one-time presentations that we do at the middle school, and then attending local coalition meetings to assist with mental health awareness and suicide prevention efforts. I just clipped a little bit about treatment services in fiscal year 24. So we have outpatient treatment located in our office here. We have a counselor that is staffed 1 day per week. We served 5,832. This is overall for the agency, unduplicated individuals that had treatment of some sort. So it was either mental health treatment, substance use treatment, or problem gambling treatment. The largest groups of ages that we serve, 69% of them were 18 to 44. 24% fell in the 45 to 65 age range. And the primary substance abuse, this is in the order that they are most used. People may have more than one substance they're using, but alcohol, of course, is the largest at 46%. Methamphetamine is 25%, and marijuana is 21% for those that we admit. And 1% of the people that we served came from Humboldt County. Does anyone have any questions?
I know it was very eye-opening when Ramona came and we started doing the prevention
Yeah.
group.
Most people do say that, and they really saw an increase in the alcohol-related consequences for health and related death after COVID, during COVID and after. So, it's
I mean,
kind of,
Humboldt County is one of the highest ones for alcohol right now.
Yeah.
Out of the whole state.
Mhm. Yeah.
And that's for OWIs, seatbelts, everything, speeding.
Alcohol related deaths too.
yeah.
Is it?
Mhm.
That's, surprising when our population base is old elderly.
Yeah,
And it impacts that population differently, so like the WISE program is really nice.
I'm gonna do the WISE. June.
Yeah.
Yeah.
I see you.
Yeah, nice
I
to see
finally recognize him, like, that's Shelley.
you.
I haven't seen you for
Long time,
20
yeah,
years.
yeah.
All right, thank you.
Thank you.
Thank you.
Yeah.
Right. A little bit behind, but we'll move on down to for the public hearing for the sale of the Rutland Dam. I look for a motion to open the public hearing.
I'll make that. Okay, Mike. I'll second.
And the first and second, all in favor?
Aye.
Any opposed? Motion carries. Public hearing is now open. You can always raise. So if anyone here to speak, now is a good time. Do we have written objections?
I haven't received any. Has Todd received any objections?
I was wondering, is there a contract of that dam given to Rutland to see what they gotta operate at?
I mean, a permit from the DNR is what you're asking.
The contract on the tilt, the dam, where they got regulated to be at 100 elevation to 103 at the Murray Bridge. That's a real critical part of this dam. And I don't know, are they aware of that?
Rutland is
aware.
currently have the responsibility.
Giving them a copy of that agreement. I talked to Susan extensively about how that goes and offered to show her or kind of walk her. through.
And I would hope that the conservation board would still assist us at any time we need it.
Yes, that's why they're getting rid of it for liability, because there's lawsuits and stuff that could pull them up, because they can't, they didn't want it for it. Can let them hold these lawsuits. That's so, just so you're aware. Because the Corps engineer back, Peterson was on and Bruce Reimer was on there when they, right before they put the gates in. We had a big meeting here with the Corps engineer who was talking, and they recommended Fort Dodge was the same way. And they would not put no more money in the dam, so they'd tear them out before they did anything to them. But they are liable for whoever takes it over. And drainage districts as well as dredge ditches. And that's what I brought up the situation, everybody from Rutland to Odison, would probably sue them if they didn't clean them out and keep that water. And they said at that time, those gates would probably have to be open for 6 months to a year before all that dirt would wash out, at least it's wide open, because the gates are there now, but they used to have turbines too. Let the water down underneath it, took the dirt out all the time. Well, there for, I don't know how many years it was closed, and all that dirt was built in there, just so you guys know what.
Well, ideally, the conservation and the county would be responsible for their situation. And Rutland is willing to take on the responsibility to assure that the dam stays still.
So the conservation still gonna have some liability in this, and you say?
No, I'm just saying, ideally, they would take on their responsibility, but they, neither group has taken on the responsibility, it's been neglected, and so we are willing to take on that responsibility to ensure that the dam stays standing for future generations.
Or they operate, I don't know.
We intend to operate it. Yes, sir.
But you know, the marks are on the Murray Bridge, correct?
The what?
The marks,
Oh, the high water.
high water marks.
Oh,
Your
okay.
engineer went out and put the marks on the Murray Bridge at the elevation. At that time, the 103 elevation was like 5 foot underneath the river channel. That's how much mud was in there. And he said, and then Paul said that they thought, well, maybe it was wrong. I said, I don't think it was, because I surveyed it too. And the benchmark is on the south northeast corner of the bridge on a bolt. You had to go over to the other side, so yeah, I had to survey 30 feet, so I don't think you could have got off very far. And I think your survey mark was 1/4 inch off mine. We're talking about feet, we're not worried about 1/4 inch. But I'd like to see those, if they could, put those marks back on there so you guys could. There's still orange marks. I just looked this morning, every foot there's an orange mark on the southeast pillar. And that's what they went by. And they'd open it up and close it by that marks. And then just more or less open it up all the time, because Bob Lonnis, you guys don't realize that Bob Lonnis lives up by Bragg. He had a rock size of that table there in front of you. They'd go out and sit on in the middle of the river. And up by Bragg, 1 mile east of Bragg. That rock, limestone rock, cannot be found, and it wash out.
I know it.
It get covered up by dirt. And that's all that dirt's gotta get washed out.
Well, and then Humboldt is with their gas plant. So
Yes,
that
yeah.
will continue to flush that.
Yeah, you bet.
Okay.
And just so the press knows, that's Bruce Hefty. I didn't know if you knew the names.
No,
Yeah,
we don't.
no, I know, so I thought,
We appreciate that.
you're welcome.
I'm not against the dam, as long as I know the liability behind it, because there's a big liability there. Big.
I do believe the reason Rutland wants control of the dam is because Humboldt County, this county's conservation board wanted to lower the dam. And they were opposed to it. They want to have control over it because it's part of their community and they want to keep it the way it is. So that's why we're letting them have the opportunity.
They wanted to lower the dam.
Lower it.
Humboldt County does.
Humboldt County and the Conservation Board, there is funding to lower the dam. There's no funding to maintain it for grant
Repair.
purposes.
What would be the purpose of lowering? I'm just curious.
What would be the purpose?
Mhm.
It lowers the water level above the dam, so it helps drainage for the farmers. It still slows the fish moving upstream, so it keeps the fishing available in the dam. It doesn't stop the fish like the dam currently does. But it would allow, because the DNR is in favor of fish moving upstream and the mussels, all that stuff. So this is a compromise, I guess. They want control of it, so.
Was funding to lower the dam.
There's grant money for lowering it. There's no grant money to maintain them. That's what we found out in all of our research. Believe me, we spent time. But. Is there anything else?
I have I guess I have an issue that I'm still having a hard time swallowing that. People of Rutland, 113 people live in Rutland, the city of Rutland. And they're willing to take on a dam that the county and the conservation board have neglected for how long, and we're pawning this off on them in order to keep the dam. I just have a hard time. Being as I represent that small town, I just really think that we've dropped the ball. The conservation board has dropped the ball. And they're taking it in order to keep it. I don't understand that. And I don't understand a lot of it, so.
Anything else? I'll look for a motion to close it with the clearing then.
So move.
First by Bruce, second by Mike.
Yeah.
All in favor?
Aye.
Any opposed? Public hearing is now closed. Okay, now we have a vote to adopt resolution 2025-02-24, a resolution for the conveyance of real estate property.
So I have one more question before we vote on this, because I have a feeling it's gonna come around full circle. And that's my area, and I live on the dam, or on the river, and I've been told before that I can't vote for stuff about what's going on in the Humboldt Dam. So do I nay, abstain, or pretend I'm absent
I think you have the right to vote on this in my.
on this one? But it's still the same body of water,
Yeah,
and it's going by in my backyard. And then I've been told that the reason I can't vote then, when the Humboldt one comes up, is because I have a vested interest in it,
right.
which I don't understand. It's still my area.
Well, I would say if you want to abstain, you have the right to abstain.
Yeah,
Well, I'm just trying to figure out what I'm supposed to do, because I guess when, and I'll use this example, when you guys both live in the country, right?
Yep.
So if Ben came in and wanted another $100,000 to rock roads, you both live on rock roads, would you abstain?
Probably,
You would?
yeah. Cause it's my road, I drive it all the time, I can't say, hey, I need rock here. It would,
I'm just-
it would
I'm curious.
benefit me,
I would disagree with you, Bob.
you think so?
Yeah.
The vote would
It's a
be for
public
the,
road.
For the
Yes.
whole public,
It's-
yeah.
It's not,
It's not
now if
just
they're gonna rock your private lane.
Right.
Right.
That's
That'd
well,
be
different.
that's,
That
I
makes
didn't
sense.
ask that question. That's a public river. The state owns the flipping river. So. Just. Trying to get it straight in my head.
Did you ask John what you should do? Maybe to clarify?
So we're gonna ask the county attorney that we asked at the beginning of this fiasco, who told us that he was good with this group. Taking over ownership of both dams. But yet we weren't good enough with that, so we went to the Allers and Cooney and spent over $10,000 of taxpayer money to get a ruling so that it made the conservation board and the board of supervisors look good. That, to me, is a little stupid.
Bruce, I don't wanna fight.
I'm not arguing, I'm just asking the
You
question.
didn't answer my question.
I didn't ask John.
Why?
I didn't know that I should.
Because to me, that would clarify things very easily. So
And John told me, getting back to your question, he didn't want to be involved in this, and that is why the Conservation Board pursued other outside legal counsel.
He was involved in it. He gave us his opinion at the beginning. His opinion was that that group could have the operation of the dam.
That's not the conversation I had with John. It was like,
Okay,
Well, I think we're getting off topic here. We're talking about the Rutland Dam currently.
which will soon follow with the other dam.
Yes,
Okay, so let's just go ahead and vote.
okay. Yeah, this is a ruling, resolution, we need a roll call vote. Where's that, here it is. Bruce,
Nay.
Sandy,
A.
Bob,
Hey,
Mike,
hey,
and Peterson votes A, or I. It's a 4-1 vote, resolution 2025. Did we get a different number on this all of a sudden? Cause I read a different number.
yeah, I copied you.
All right. Okay. Right, okay. Okay. Resolution 2025-01-20 is approved with a 4-1 vote. So I gotta sign that. And I do believe if you do choose to lower it or remove it, there will be grant funding to help you out. So it's the same as we are, it's just under a different title right now, the funding is still there. But I do believe the conservation will help you search for funding. Okay, moving on, Brett,
Okay. Here we go, round two.
round two, dam number 2.
Yeah, like I said, everybody, this is not personal with anybody. I sent you guys some stuff last week. I added a few things I didn't have with me at the time that I sent that. So just giving you a little handout, we'll follow through with. One more, Mike?
Yeah, there you go. One more.
Okay, I'll go over this side. So anyway, some of this is repetitive to what we had, or what I sent you guys on. This is the steps, you know, if the river development group could take over the management of the Humboldt Dam. The short-term plan, the long-term plan, have you guys all had a chance to just glance at that? What we plan to do now? So, go ahead.
I'll be honest, I haven't, I've been sick on the dog.
Oh, well, that's why I'm sitting over here, not there. So anyway,
But I'm pretty familiar with.
yeah, well,
Your idea.
yeah, this is what we propose to the city too as well. You know, fixing the cables, we'll get the gates operational, just do some of those minor things that we can do ourselves and that aren't gonna be very expensive. And then it shows our long-term plan and going after funding, FEMA, Homeland Security, and all those other grants are available. What I did add, go to page 2, the stability analysis. And the reason I brought this up, this is from Axiom, the engineering company we talked to about, because nobody ever studied, nobody ever spent any time, the Stantec report didn't talk about the structure of the dam, the life of the dam, you know, how strong it is or how weak it is or whatever. And one thing, there's a couple things on the second page I want to point out at the bottom. It says the possible shear loss. Those were when they did the engineering to build the dam, they were in the engineering reports. But Stantec could not verify that it was done at that time. So therefore, they cut the life of the dam. If they could prove they were in there, they said the dam would have at least 100 years left. So because they can't prove that they're in there without a ton more research, that's when they gave it a 50-year lifespan. The other thing that I want to bring to light is that the silt, and this was new to me, I thought, well, the silt against the dam is going to cause less pressure on the dam. But the silt, if you think about it,
it's basically a retaining wall with silt. So the pressure of the silt is just about as strong as the water, not quite, but just about as strong as the water. So then you go to the next page, I just pulled a couple of pages out of the accident report where it has 50 years of life. The other thing, go on to the next one, we were talking, if you read through that Ehlers, the Cooney's report that the conservation board got on what to do with the dam. A lot of that they talked about in there was, related to different dams. Well, Humboldt's a low hazard dam. So a lot of that didn't need to be in there, I don't know why he put it in there without knowing what it was. Todd gave this to, Dale Jensen. Todd checked with this DNR, correct, Todd?
Yes.
And Humboldt is considered a low hazard dam.
Yes.
Therefore, legally, we don't have to do inspections every 5 years. It's not a bad idea, but, we've talked about, we've missed some inspections and stuff. As it turns out, the conservation board did nothing wrong by not getting those every 5 years because it's a low hazard dam. So they're in the clear on that. The next thing we talked about is insurance. And the reason I put this here, this is a letter from Scott Curran. When we've talked about, we could be additionally insured if we took over management. Took it from the conservation board and you guys would assign us, or if they would relieve it and assign us for management of it. We have to go get it in writing that we're additionally insured, but that's how they would proceed and it probably would happen. So we would have insurance. The reason I bring that up is, they were willing to sell us the dam and if we could provide insurance. So then we were working with the city. We couldn't get insurance because the state owns the limestone underneath or they own the riverbed. So you had to have a sliver of ground. Susie found this. You had to have a piece of ground touching the dam so you could get insurance. Well, they said if we got a sliver of ground from the city, which they were gonna give us a 99-year lease, or they were potentially doing it, it sounded like it was gonna fly. They were gonna give us a sliver of ground for a 99-year lease, and then we could get insurance on the dam. And then, 4 members of the conservation board called the city, called Cole and told him that they were gonna sell it to us no matter what, they sell it to the city. So that just brings light to, for 10 years, everybody says we're up here being objective or grumpy or this or that, or some of the meetings Bob's been there, Todd's been there. Some of them got kind of heated, but the finish line got moved one more time on us. And we're, and there's proof of it right in public that they called the city and said, they're not gonna sell it to us no matter what. So it's really disheartening, that happened. So they go on the next page. So I just put together some of the consequences of you guys taking option 2. Number one, you're gonna need some taxpayer money. Yeah, there are grants available, but you're gonna have to pay some, you're gonna have to come up with some money. You just sat and told public health, you don't have 20 grand for them. How in the world do you have money for a dam? We're not asking for a penny. You have nothing to lose by letting us try to take over the maintenance. Only thing we would ever ask from you guys, somebody's gonna have to sign, for a grant or Homeland Security or something. We can't sign for that the way it sounds. But we just ask somebody on your board to sign, for applying for funding in that fashion. You can read the 8 things I put on there. The big cost to the city, now you're gonna cost the city money because they just bought that Lanier property and want to do some things, ice skating rink and a fish pond for kids and all that stuff is what they want to do with those ponds. Well, if you take option 2, now the city's got to go buy a pump or drill a well or do some way to fill those ponds. And when they took over the ponds, they have to maintain them as ponds. They can't just go fill them in. The DNR, when they took those ponds over, they have to maintain them as ponds. So now, by taking option 2, you're costing the city money when they can just use the mill race and water flow for free. And the mill race, if we get the gates working there as well, which we plan on, that helps flush out the river as well. Number 3, it'll destroy the boating on Lake Nokomis. Number 4, lowering the value of the houses on the property on the houses. Number 5, just like Bruce, who will be responsible for the actual loss? It's one thing to go ask for your taxes to be lowered because we can't use the river anymore. But it's another thing. You're gonna have an argument about, well, my taxes need to be lowered because the value of my house went down. Well, when we bought that, you know, we had a river that I used to have 3 boatless in my house. And when value of my house goes down, who's gonna repair or take care of that value of the house? Just like Bruce said on farmland, if you don't take care of the gates and you aren't able to flush out water, who's gonna take care of that? He just said everybody's gonna be in line to sue you guys, you know? So, I mean, I don't know who's gonna do that. The other thing, these are the important things to me, that narrow a channel. We've already seen all these volunteer trees on the sandbar up there, right by the dock. Well, if you narrow the channel, you're gonna have volunteer trees growing on both sides of the river. It'll take some time, but it'll happen. And as you go look on that sandbar now, there's huge logs stuck on it and everything else. Well, they're gonna get stuck on there in a high water event. You're gonna start flooding areas that have never flooded before. Somebody's gonna come screaming at you for that. And then on number 7, I just did my own dumb analysis. If you have a 5-gallon bucket and a 2.5-gallon bucket of water, you put a gallon of water, only a gallon of water is gonna flow through that. By cutting the east half of the dam in half, yeah, you're gonna squeeze the dam down right there, you're gonna create more water flow for that half. But then, when we open the gates, and Todd can attest to this, you open the gates, it doesn't take long for that water to dissipate or spread out down the river. So what are you really creating downstream from the river? When we talk about canoeing and kayaking and everything else, what are you really creating? You know, and everybody says, oh, I gave you a list of people that signed up. There's what, I don't know how many are on that list, over 1,500 people that want to save Lake Nokomis or have something to do with it. You know, there's, you know, everybody says, well, we can create visitors by canoeing and kayaking. Well, there's 1,500 people there that want to save Lake Nokomis. Don't they have a value? In fact, the county or the conservation board bought Northland all their canoes and kayaks. Has anybody seen those advertised? We talk about canoeing and kayaking is a great thing. The conservation board's sitting on a trailer load of canoes and kayaks, and nobody's seen them advertised for canoeing and kayaking. It's such a hot deal. You know, it just doesn't generate the revenue. And then the last thing, I think it's most important, and I'm glad Susie and Rutland stepped up to, I feel like Bruce does, you know, they took the burden off the hand, but it was a big asset to their community, is why they did it. You know, and I commend them for fighting this long to save it, you know, but our group has made the commitment to help Rutland if we raise money to help them fix their dam as well. If we can't do management of Humboldt and can't fundraise for Humboldt for Lake Nokomis, our fundraising is gonna go way down. We're gonna have a lot less money to help them with. You know, so we're doing them a disservice, I think, if you do option 2. And then the last page, I put on there, just would you guys consider giving us a 10-year management agreement on the dam? In the meantime, I don't know how you did the Murray Bridge, how Ben hold money for that. But if you let us take over management, we're not asking for a dime from the public. Like I said, you just didn't have 20 grand for the public health, which is very important. Why is the hospital sitting there losing 200 grand? They could turn around and tell you guys, hey, it's supposed to be a supervisor and hand you the whole 200 grand. You know, I think I'd find a way to help them with 20,000. They don't throw that back in your lap, the whole thing. But anyway, in the meantime, the board of supervisors will start saving 30 to 40 grand a year. Because if we fail and there's a big problem and we can't take care of it, you'd at least have some money hold for a grant, or excuse me, grant or your share of taking out the dam or doing whatever you gotta do. We're not, like I say, we're not asking for money. And if there's a big problem, we can't handle or take care of it, we get in over our head, you know, then we'd probably give you, you know, half of our money to Rutland and half to you guys to help tear it out too, you know, whatever monies we'd have left. You know, so I know we've all wrestled with it and everybody's tired of it, but it's such a huge asset for our community. We got over 1,500 people that, I gave you the list, that want to see Lake Tacoma stay. The big thing is the gates. You know, we were told for 15 years that the gates didn't work. Well, I went out there with a couple of big pipe wrenches and got it loosened up, and then I want to thank Todd. Because before the big flood this year, Todd went out there for 3 or 4 days in a row and greased it and oiled it. And then I went with Todd that one Sunday morning with a little Honda generator. We opened the gates up.
Yeah, I stopped by.
Yeah, so they do work. You know, it's all they need was some grease and oil for all these years. And the other thing, if you stop and think about it, we have those things in the air, you know, we had to be releasing, I don't know, Todd, do you know the flow through there?
No, I don't.
I mean, it had to be millions of
Don't even
gallons a
county.
day with water flowing through there. But you thought and think about those gates are up in the air and the water got so high, the gates pushing, the water's pushing against those gates at a lot higher, giving more leverage if it's gonna wipe out that gate system. It didn't do a darn thing to it, did it?
Don't see any difference.
I know, it's just amazing. I mean, it's old and clumsy or, you know, simple, but boy, it's strong the way they build it. And that's gonna be one of the first things we address, and the one thing we'd like to do is, because it is corroding really bad around there. Putting an Overmeyer style gate, which would actually flush to the bottom. And when we talk about flushing, Todd's been out there, if you go out on that sandbar, right on the corner. You can see where it's cut about a 4-foot ledge. It used to be just a gradual, you know, silted in slowly, kind of pushed it up there slow, just slowly went in the river. It's got about a 4-foot direct ledge where the sand got cut off. And
But- Putting new gates in that is not gonna flush that silt out.
it just did, Bob. That's what I'm trying to tell you right now.
How much do you think how much you actually think it's gonna flush out?
It's not gonna happen overnight, but it's gonna happen. And our actual goal is to put the gates the size of Rutland. That's what 1,000,001 is. If we put Overmeyer's the size of Rutland, they're putting out over 4 times the amount of water flows through them if they're both open.
Well,
And they flush the bottom.
I happen to disagree on how much silt it'll actually wash out, so.
Well, after the meeting, call me. I'll walk out the sandbar with you and show you where it's cut a ledge on there. Bob, it did.
It is.
And so it might not happen in 3 years or 5 years, but it's gonna cut that out and keep it clean now. What do you think kept it clean for all those years when we opened it in the spring? Along with the city owns the mill races, and it would help if Cole would help us apply for some Homeland Security and FEMA money, which he, you know, said he would. We'd get him on board to help us write those grants because it pertains to the city. Then we put new gates in the mill race as well at the same time, because that whole mill race is getting silted in too, so it'd help flush that. So we have, you know, you guys might say it's pipe dreams, whatever, but you know, we're not asking for any money. You guys are brilliant. And we have a great asset that we're trying to save for future generations. You know, I'm not gonna water ski anymore, obviously. But doggone it, I'd like to save this, help save this for future generations. You know, there's people that don't live on the river that, you know, I'm gonna Reed Carroll. Him and Newton Kid, there's about 3 or 4 kids. These guys are 18 years old and they're out there in a $500 motorboat pulling each other up and down the river on tubes and trying to ski, but the boat wouldn't go fast enough. I'm watching and thinking they're having the time of their life. You know, so it's something for everybody. We grew up pretty poor. We didn't have, we had a bike and a paper route. We played up and down the river everywhere. So why take that away? We floated that river. Went to OK Tire and got an old tractor too, and we floated down the river because it was free, you know. So it's an asset, like Bruce said, it's a public asset. I'd hate to see you guys take an option when you don't have any money and you're destroying another option to do it. So, thank you for your time.
All right, thanks.
Please. I don't know how you guys all stand, but I don't know where we go to do this. The other thing I want to say is, you know, the conservation board says they have full control of it, but they really don't. When you read through Ayler's and Cooney's thing, you guys have the final say. You know, it really is owned by the county because they really can't own it. You know, so, I mean, that's in the lawyer's report from them. So it comes, you know, we've tried, how many meetings we've had? A lot. They're tired of it. Bob's been on, they're tired of it. What do you got to lose to let us try? And Bruce knows of some of the commitments we've got for fundraising, the commitments are there, but I'm personally not gonna give any money until we know we can give it, and I'm gonna give some money. A lot of people are, but why would I put money in there now? If we don't know what we're gonna do with it, you know? I mean, that's not a fair ask for anybody. So. Mike, do you have any questions? You're just getting in the middle of this now.
in the middle of it.
So,
Welcome.
Thank you for your.
Yeah. you bet,
Thanks,
Brett.
Ron.
Thank you for coming in. Okay.
Thanks, Brett.
Now, 9:30.
Thank you.
Call me afterwards. I'll
I
walk
will.
out there with insurance.
Okay, discussion of employee benefits in lieu of pay raise. That was brought up. Due to the fact that our budget is so tight, we'll probably looking at a 0% pay increase each year. And there is discussion of, is there ways we can compensate employees with vacation time? So that's what this is about, and it's just discussion. There's gonna be no decisions made today, but it's just discussion for thought. I know Ben isn't here, and I've had some conversations with him. And I know his opinion is, he would like to maybe convert some sick days to vacation days. To give the employees more options.
How many days? I mean, are they thinking?
We don't know. Well, a couple of.
Sure.
Well, Is
Four or
it
five.
11 sick days right now? I think it's 11. isn't it?
Looking at 5 in that region.
Yeah. Cause a lot of people don't always use all their sick days. And that would give, some people use them all every year, some people aren't as healthy as others. Or they got other issues. So it was something to talk about. I know Janice sent us a list of some days that she would thought were possible. If I was to look at any of those, I'd look more at your federal holidays when the banks are closed and post office is closed. So, and I know Sandy had talked to Mike Galloway about that. And if we do look at this, I think we'll look at it through our personnel policy and make a change there and make it a permanent change to make it easier to attract new employees. Because whenever you're looking for new employees, about the first thing they ask is, how many days vacation do I get? I think most everybody agrees. People these days, they are not so much concerned about how much I'm getting in hours, how many days off do I get, right?
Yeah.
In our, currently, I believe it's the first year you get a week. I believe,
You guys didn't put that in too long ago.
no, that was
that was just
before you got
Yeah.
a week. And I thought that was,
Was the last 2 or 3 years. I
Yeah.
think we did that.
so I think that's the way to look at it,
Mhm.
rather than just do a 1 year thing and then worry about it next year, but I think we need to look at a personnel policy change.
New hire and retention, you gotta look. at
Yes. And it is it does cost you because you're not getting any productivity for a day. But, happy employees are productive employees. So the happier you keep them, the more work they get done. That's my thoughts. I'll let anybody else talk. I'm done. So,
That is true. People are looking more towards quality of life instead of how much money am I mean, everybody wants to make money too, don't get me wrong, but it's a new era.
Yeah.
They're looking more at quality of life versus how much am I gonna make in a year.
I had a couple of the employees reach out to me from the Hardy location. And they found out what was kind of going on, and they were happy with the idea of vacation days. They were tickled pink. So. An extra 4 or 5 days a year, they were happy as could be.
vacation days, yes, we got structured so that if we get a snowstorm, we aren't paying double time and a half.
Right,
Right.
that's why I look
Right.
at the holidays, we're gonna wanna do, they're not gonna be in the middle of winter.
Right.
But what if they have it scheduled, like a year in advance, instead of going to Cancun for a week, and they already have that?
Oh, the vacation days for them, I know Ben does work with individual employees, but I was looking at these holidays there. You know, I don't wanna mention that. Because, like I say, we don't wanna have to be paying time and a half for a
Right.
vacation day, when, oh, geez, that's snow. No.
So you're, trying to read through this Janice sent us, or gave us copies of the green is. What's the color code, the yellow and the green or what?
The green would be just be added on. Like the yellow is what we got in the manual now, or in the personal policy. The green would just be the extra days added on.
So that'd be the entire courthouse would be closed.
Right.
And those, a couple of those, I looked at, like the Friday after Christmas, well, you can't use that, because that changes
Yeah.
all the time, you need to use more like your federal holidays, that will
Yeah.
always be a certain day.
Well,
I agree with-
when
I
I
agree
did
with
it,
that.
I just did it
I know.
for like, for the
This
next
year.
coming year.
Yeah,
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 I didn't do future.
Yeah, I think federal holidays, if we're gonna do that, it'd be federal.
pick up all. Sorry. So I think that's something we'll, when Ben gets back, we'll bring him in soon, because he has the majority of the employees are under him. And the holiday overtime pay affects him more than anybody, so I think it's important to have his input.
Yep.
I think it probably would be a cheaper option just to go with extra vacation days instead of
That's what I
saying
was
holidays,
thinking.
because you're gonna have Ben's office and the sheriff's department.
Yep.
Making holiday pay an extra 5 days a year.
Yeah,
That'd probably be a rough one.
Well,
yeah,
that's why we're having this discussion, to
Right.
break those things out.
And like down at the bottom of the letter, most department heads would rather have the added on vacation. Just, we were just throwing out
Options.
options
I would-
for you guys to look at. So,
Okay,
Well, I had one person ask me and over here where you guys have your time slots for doing appointments.
driver's license.
Yep. So, when they are pressed, trying to get off work or coming in at lunch or whatever, would we still remain doing them? Time slots?
We try to do walk-ins also, if she's
Well,
not,
not the way I hear it. We don't do a very good job, but
but you also have to remember, she also has re-exams, lines. And all that to do. So the state will send in, if somebody has an issue with their driver's license and it's reported to the state. It's reported to us and we have to pull them in. So there's all kinds of scheduling and things that she has to do with that. So it's not that she's sitting back there not having anything to do. She's working on her stuff from the state. People don't understand that. People don't understand what goes on behind the counter. You know, but we do try to work people in when we can.
well, I know it'd be
So,
great.
I
if we-
mean,
Cross-trained in your,
Huh?
other people cross-trained in your department, or somebody else who step up and do it, and ask it.
We're all cross-trained, except for Lindsay. Lindsay just does, she's starting to cross-train in motor vehicle. But she's mainly driver's license, because she does drives a lot more. So we used to only do drives Friday mornings. We do drives 2 days a week now, and sometimes she'll have 3 or 4 drives in a day. Well, then we don't have, because I'm trying to do my stuff, and then Carrie and Ashley are doing their thing. So, but we try to work with people and get them in. And Lindsay has squeezed people and they called in the last minute. She goes, hey, if you can get here, I'll get you in before this next person comes in. Or she'll say, have a seat, wait. And once I get done with this other customer, then, you know,
well, I don't ever get those calls that someone worked in. I get the calls that I came from Fort Dodge because I got pulled over on the way to work. Was told my license was expired. I came back to Humboldt and they said I can't have it without an appointment. So now I'm already driving without. And
I
I'm
mean,
just the
there's
person
Fort
that's,
Dodge to go to, their appointment
Yep.
also. So if you go to Fort Dodge to the driver's license, and if you don't have an appointment, what they tell you is you sit, you wait. When we are caught up with our appointments, we'll squeeze you in. So. Cause the state, people don't understand, the state was gonna go to appointments anyway before COVID happened. When COVID happened, it just pushed it faster, so. And also, the state closed down on Saturdays now. They don't do Saturdays appointments, they went from Monday through Friday. And so their hours have changed and are limited, so.
well, on the average, how many, driver's license you do a day and then a week? Do you do 5 a day? Do you do 25 a week?
No, we can do every half hour. Is what she does. Drives take longer, they're about an hour. Cause she's gotta do the paperwork and then do all the stuff, so
What do we get for revenue off licenses?
$7 a issuance. But
Yeah.
re-exams and all that. We don't get anything for
That's,
this.
that's
It's
the
our
thing, the
time
county
for
does all the
state.
work and we get none of the money.
Yeah, I mean, it's the same way with motor vehicle. When you guys do your registration,
That big check.
90% of the money goes
here.
back to the state. We're doing the work for them, but the state gets the money.
Have you put anything in the paper to let people know that they need to have an appointment? And I know it's not expense for advertising, I get that.
We have a website that we
Yeah,
can use
it's on,
too.
it's on our website.
I think it's, I really thought it's pretty well known. It's been this way now for
It's
3
been
years.
COVID, yeah.
4 years.
COVID.
So I say, I never get the call that
I know.
someone says, hey, they worked
I
with
know.
me.
Well, you don't
A
get
hell
too
of a
many
job.
calls. I go
I'm
there,
tickled,
I'm
but-
glad they worked me in. We don't
Yeah.
get those calls.
No, you don't get those. You get the
No.
ones that are.
People aren't gonna be-
I'm just,
Well-
we're trying to work with you guys to make something work, so we gotta work both directions, so that's my point.
Well, that's another topic. All right.
I can't make nothing today. I'm just gonna shut up.
You could have your coffee.
I should have my coffee or you have a Bloody Mary or something.
All right. So we're done with we're gonna put that on the agenda when Ben gets back. We'll have
We gotta
John
wait for
down
Ben.
with this
Yeah,
for the discussion on vacation days.
Yep.
All right, moving on. Dave, you wanna take over here for Ben for the, but you're stuck with it.
What was it? The first
Agreement
one
for-
on
The
there?
first one is the
Britson's,
Chuck Britson
Bridge
inspection. of three
inspection.
bridges.
It's just something we have to have. It's for our 3 truss bridges, the 2 high trusses.
is this every year, is this this is when they come due? For those
I think
bridges?
it's every 2 years.
That's what I
These are,
thought.
yeah, like they're not, I think so.
Yeah, I don't think it's not every year,
No, I didn't think so, but. I
unless
just
it's
wanted
after a
to-
FEMA event, then it
Right,
has to be
then they
inspected.
have to.
yeah.
And that might be what these are for, because I know we did have a FEMA event.
I think that's what the artwork that we have to have.
Okay,
We have to have an inspection.
okay, so I'll look for approval of the agreement with Chuck Britson to inspect 3 bridges. Next year,
Second.
first and a second, all in favor,
Aye.
anyone opposed? Motion carries.
Says $2,350 is what it states on there.
I was going on, you know, Ben was on, so. I got you.
Such a pile of papers here. All right, moving down, set time and date for FY 25 secondary road budget amendment, number 1.
And I see that.
Don't ask you that.
Well, we have to.
We didn't have a
put it in
date.
Paper,
You know,
that we have to have it in the paper so many days before, so we can't.
And I would like to put it with the rest of the budget amendment.
Well, when's that gonna be?
wasn't he gonna be home tomorrow or
Thursday.
Thursday?
Or he'll be back Thursday.
Was he check his email?
I think so.
Why don't you just? But then we gotta wait till next week to set the time.
Be willing to bet he would just take the time and he would be all right.
So we just pick next 2 weeks from now, or do you think that's too far out, or?
No, it has to be published.
Published in,
So I would give him,
It's like, isn't it like between 4 and 20 days?
is it 4? I thought it was 10.
10 before 20.
oh, you're not gonna get it.
I would. I would look at April.
Or far out?
Yeah, because we've got some hearings coming up. For the budget this time on the 31st.
So my question is, if we set the date and he needs the money moved before
A certain time.
that date, how do we get around that?
This really doesn't take that much time typically. I mean,
Well, it doesn't take any time, but I'm talking about
Yeah, I
him
mean-
needing the money.
That's what I mean, because the money needs to be moved. And you gotta
If he's got payments to,
make.
I guess you set the date, and if it wasn't, then he,
Well, why don't we do March 7th? If we don't, I don't see anything on March 17th. That would be
3 weeks.
3 weeks.
That should be plenty of time. All right,
Going to door.
I'll look at it for.
Okay, I'll make that motion to do it on
So
March
that means it needs to be published this week,
this week.
today,
2 days, okay,
and we can't do that.
okay,
Oh.
let's do March 24th then, the next week. At 9 o'clock. I'll make that motion.
I'll second it.
Okay, well, first and second for the March 24th date at 9 AM for the budget
9 AM.
amendment #1. All in favor? Any opposed? Motion carries. Now, Dave, question number 3.
Is that the vacate the road?
Yes, which road is this that we're vacating?
Do you know
He's got
where
it rolled
Jerry
up.
Beverly's
Oh,
house is up
yeah.
there?
Oh,
He is at
Well, this
houses.
is only vacated down to the half line. To make it official, we have to go
Okay,
up his lane, basically, up
Okay,
and through
Gotcha.
his field to
right,
get it off our books, basically.
yeah,
He has it on
okay,
the description.
all right.
Same.
And there sounds like Yelleys and Haverleys are all in favor, so.
Yeah. Okay. Shall we do that the same day?
yes.
Okay, we'll look at March 24th at 9 AM. I'll look for that motion, or 9:10.
I was just gonna say, no.
I'll make a motion.
We're the first and the second from Mike. Did I hear that?
Yeah.
Okay. All in favor?
Aye.
Any opposed? Motion carries. Oh. Is Bean still out in the hall?
I think he might have left, 'cause I saw him go that way, I didn't see him come back in.
Would somebody like to text him and let him know they'll be ready for him in a short time?
You got that?
Did you see the numbers in the back of this?
I guess we got that.
Yeah.
Yeah.
Those must be the numbers you need.
I need a resolution number on that.
Oh, on the budget amendment?
No, on.
Oh, the road vacation?
It's pretty good.
How about 03? What did we do? 2025. Base
Oh,
email it to
03
me.
dash.
I was gonna say email, and that way we,
Email it to me and then I can put it on that resolution there and I can.
I am. You are? Are you ready to check now?
Pretty please.
When is Ben back? This week.
Okay. Moving on down, approved Class C liquor license with outdoor services and Sunday sales from Humboldt Country Club.
everything's in order.
Something we do every year.
Oh, he's in Renwick.
No Dean's in Redwood. We must have got that all.
Well, I'm
I've heard
guessing
I
it's
heard
sirens, yeah.
But
What's that?
I heard sirens
Oh,
during
did
the
ya?
meeting, yeah, but I didn't know if it'd be him, but it is.
Well, he walked through there and he was headed out, leaving when them sirens were going off. Something happened. Yeah.
Everything's the same with the application,
We do this every year with.
Every-
Yeah.
Thanks.
Yeah, we
Yeah.
did,
outdoor sales and.
Yep.
but last year was different, it was late, so.
Yeah, we urged them to get it in before the season started.
It's April 20th, 2024 to April 19th of 2025, the expiration, so that should cover them. It's all in order, I'll make a motion to approve.
I'll second it.
Well, first and a second, any more discussion on the liquor license? If seeing none, all in favor?
Aye.
Anyone opposed? Motion carries.
Where,
Just anywhere on this thing?
yeah. There's no-
They're on the wall.
Moving on down to committee reports.
Get the right week.
2 weeks.
I got, they did the mobile food pantry on the 13th and she never sent me the numbers that I recall anyway. And I didn't get down there. My walker wouldn't let me go. Last week on the 18th, I had, Admiral Finance meeting, Zoom. And then, that was on Tuesday, the 18th, and then on Wednesday, the 19th. I went out to the Midas long-term planning. Out secondary roads and listened to that presentation, which was fairly painless. Wasn't Mike?
It wasn't bad at all.
I guess it was, I mean, it was, there was nobody else there, so there was nobody there to say we need to do this or this or this, so. She went over, what Ben had turned in and what we had talked about and basically, the state goes from there, right? That's, so that was about a little over an hour and then, that was it for the week.
I think it's your opportunity to put your input in if you think something's needed,
Needs to move forward or move.
changed or whatever.
And she did tell us that she's still working on our.
Comprehensive plan?
Comprehensive plan, it's getting closer, but it isn't. You can't
There
see it
yet.
on the board yet, so.
Okay, Tuesday, I was gone down in Arizona, but, I didn't attend the food pantry meeting, but Alyssa called me afterwards, so we've had discussions on the food pantry. And then also the 19th was ministerial. I didn't attend, but then Alyssa called me afterwards, so. Yeah, so it was mostly just phone calls regarding those two committees.
On Tuesday, the 11th, have the public safety meeting. And then on Thursday, we're at the fairgrounds helping with the food pantry, which a lot came through. I was surprised.
Which day?
One Thursday.
Thursday,
The 13th, right?
yes.
Yep.
And then last week, I think Martha was gonna have a meeting, but they canceled.
Canceled.
They canceled because of weather and that's
Yeah.
all I had.
Monday went to the Farm Bureau meeting. First one I've been to, pretty. Just explained what we're doing and it was very informative.
Some really good 7-layer salad.
It is.
Awesome. It was awesome.
We
Yeah,
thought
they
about
always-
you.
they always have a great-
Ben said he was gonna take a picture and send it to me. I said, I'm on my way home from Rochester.
Oh, okay.
Yeah.
then Wednesday we had that county budget meeting, we come in and, after that I worked with Betty and Trish on the budget for a little while. Thursday went to the food pantry and handed out meals with Bob. The 19th Wednesday, I went to the Midas meeting with Bruce at the shop. And then I proceeded to go to Des Moines. I started my weed commissioner meeting every Wednesday, Thursday and Friday.
How'd that go?
Actually, you know,
Oh, don't say it, cause then you'll be following Eric's footsteps. Actually, it wasn't bad.
no, as far as knowing what the invasive species coming into Iowa, and actually we have this, a Japanese copperleaf, they call it. They had a lady up there talking about it, and she said this guy put in post-emergent and pre-emergent, and it didn't kill. When he combined, the beans were dead and all get out, but looked like he was driving on a carpet. And it's in Humboldt.
Japanese what?
Japanese copperleaf, they call it. It's a new critter coming from Illinois. It's in like 6 counties in Iowa, and we happen to be one of the lucky ones. And it's resistant to glyphosate, it's resistant to Q4D, it's resistant to Treflan. They're looking to see what kills it. They're still working on it because it sends out, you kill the plant, but it sends out rhizome. So you'll kill this little guy, but there's 25 more comes up.
Wow.
Is that like crabgrass then?
It's
Isn't that what
still-
crabgrass
it's
does? It says
Similar to
that.
that, yes, but it's just a new bit news. I mean, pick up stuff like that all the time. And then I had the opportunity to talk to a lot of weed commissioners and just kind of ask them what they made a year as compared to what
A
we're,
lot more than you're getting.
a lot. Well, yeah. But it also verifies that what we're doing isn't wrong because what they were getting was more than we're paying for our weed coverage. I was doing my
Just
own
their
little.
administrators getting more money than what we're paying B and W.
Exactly.
Gotcha. Okay.
Exactly. It just,
That's good.
I just kind of do these little things on my own and just kind of,
So, I mean, from a county's point, we're squeezing as much as we can.
yes. Because, but if we had a weed commissioner, I know what I asked 3 or 4 Iowa County, I mean, I was all over the state, I was asking people, because it was all there. And just kind of taking my own little survey and seeing what they're making, it's substantial, and then they had people that helped them.
Then they have staff
They have, yes, and it was amazing to see the amount of money that,
and equipment.
some of them only had a little sprayer in the back of their pickup with a hand sprayer out the window, and that was all they had, but some of them had the booms and the equipment like. I just thought I'd throw that out there.
I forgot we had to do 2 weeks.
Well,
So on the 11th, I had an ISAC, education Zoom meeting. And then on the 12th, we had that, courthouse budget meeting, all of us. And then on the 13th, I had a mental health advocate Zoom meeting. And then on the 14th, I had an ISAC legislative update webinar. I know.
ISAC,
You have to
ISAC,
pay.
what was it, educational?
Okay, the 11th was the educational Zoom.
Okay,
And then on the 14th was this legislative update webinar. Those are pretty, I mean, they're short and sweet, but they're pretty informative. You got legislators.
squeeze that in.
Okay, going way back, the first Monday, I had the Farm Bureau. And then the following Wednesday, the board meeting, the building.
211. Okay.
Here's like that.
12 was what?
The
Oh, budget,
budget.
okay.
And then I had 6 grandkids the whole next week.
Guess who got sick next?
Yes, and I had a doctor's appointment on Friday.
Sorry, I didn't mean to laugh.
I know, but
Kids.
love them dearly.
Yeah,
We also
little
I-
germ bugs.
gave you that phone number of that guy that called.
Oh, the drainage issue.
Drainage up on Bradgate. He's looking at doing some drainage up there in section 7 and 8 of Rutland. And
Yeah,
he called Rick as well and
I spoke with the landowner, the tenant, not the landowner, the tenant. And then I spoke with David
Dave
Hunter,
Hunmark,
because he'll be
neighbors with the
also
land.
involved in it. And I told them to seriously think about doing a county project. Because of the age of, and the undersize and all the people involved. It just keeps it cleaner. And it's a little more expensive up front, but it solves a lot of problems for the next generation.
And he's Hemlock,
He's from Humboldt, well, West Bend area.
West Bend
He's a
area, he
fair.
farms down here, yeah,
He's
so,
a fair from West Bend area,
Oh,
organic farm.
Mhm.
yeah.
They want a pattern tile. 300 acres, I think.
In order to do it, he has to have the
Decent outlet.
decent outlet, so.
That's kind of the way everything's going, is this whole county's getting pattern tile.
oh, yeah. I'm amazed every winter how far, how many we see
A
going.
lot.
Mhm. Alrighty, anything else you come before the board?
We'll talk about the insurance or no?
Or do you want to do that with the budget stuff? That's
Yeah.
just.
Information for a budget.
And she's coming.
What date she put, 17th of March?
Seems so far out.
Does it say on there?
No,
Well, this didn't renew until July 1st, so.
Yeah,
no. Yeah, there's no. On
for some reason I thought it was the 17th.
next Monday.
Next Monday?
Oh, wow.
Denise, right?
Yeah, Denise Valley.
At 9:15.
It should back things up. Oh, I mean,
9:50.
15.
Okay. See nothing else, I'll look for a motion to adjourn.
I'll make that motion.
I'll say.
First, second, all in favor?
I.
We are adjourned at 10:07. We'll break and then we'll go into a work session.
Water fountain up here.
Kind of still, we don't have a water fountain.